So this is the postnatal, postpartum section of your Badgernet maternity training for our neonatal team, i.e. neonatal doctors and ANNPs. So as we've already gone over, obviously I'm currently on our pregnancy summary page, which identifies our previous health history, any risk factors that we may have. Obviously, in this example, this baby has now delivered. Therefore, there is information about the labour and birth in green and information about the baby. There's a current baby risk assessment, a management plan, and a feeding plan in place. We can also now specifically view the baby itself. So once the baby's born, obviously we can create a separate record for it. So in this case, if we click on overview, it will give us a summary of everything to do with that baby. So you've obviously got your routine information that you might need. You've got an overview of the feeding plan, any previous specialist reviews are viewed here as well, any risk factors, management plans, and so on and so on. And obviously your first examination here. If we go into summary of care, we can see any care that has been provided for this baby. It sorts it out specifically into days. So obviously on the 11th, as in today that I'm recording, records have been created for this baby. So I have a big long list of different forms that have been completed around care for this baby. You can view what has been written this way. So if you know the date that a blood test was taken, you can come into your day of birth, go into the blood tests that you are looking at specifically, look at a blood glucose and see what the result is at the bottom and whether anyone's marked any notes about a plan. On the desktop version, when we have requested any blood results, we will eventually have an ICE view here, so the blood tests that we will have requested will be viewable here. Obviously, in the case of a blood sugar, that's not applicable. So we can also scroll down and look at our charts. So specifically, if we were looking at our hypoglycemia levels, this chart plots where those levels are on a form. On a chart, so we can see how obviously things are changing. So, and you've got your colour code up in the top left hand side. So this is obviously a pre-feed BM and it's within the normal level. To see any levels relating to jaundice, we've got a bilirubin chart. So in this case, we're going to scroll back to see the day that we want to. There's obviously a chart with our key at the top. So black is transcutaneous, orange is serum, our blue is exchange transfusion, and our purple is phototherapy. So as we scroll down, we can see obviously these were both taken on the 11th. One is plotting above the transfusion line, so that's our transcutaneous bilirubin, and our actual serum bilirubin is in between the two. So obviously you can make your recommendations according to that. On the desktop version, the units go up in tens, so obviously therefore we can say it is currently 2 boxes above the line. Whereas if a member of our neonatal staff, nursery nurses or midwifery staff, if they show it to you on an iPad, that scale is slightly different in that it goes up in units of 20. So it's just something to observe and just make sure what units it's going up in. Obviously, as things change, it will also track those changes as you go as well. There is also a chart for your neonatal centiles. So all of these charts are appropriate to your gestation of baby. It works out automatically. So we've got a weight here. You can see this baby was weighed twice in one day, and it lost 200 grams. So, but obviously, again, it's quite good for knowing when things cross over centiles and where birth weights plot in regards to your normal centiles. And you have the same for length, head circumference as well, but we don't routinely use those. So our last chart that I'm going to show you is our newborn observation charts. So if we click into here, we have a version of a news, which again will show us a temperature, a heart rate, respirations. Obviously we've got SATs recorded on here, any other information. You also have whether someone has escalated it to a paediatrician, i.e. neonatologist. It should also be working out your risk levels. At the moment it's not, so I will make sure that is up and running by live. What we will be doing is recording our observations in Badgernet, but it will transfer over to Patient Track. So we will still have the alert system that we have on Patient Track, and we'll still be able to record how often our obs are done that way. This is obviously, this system does lack an alert system and a good trigger warning, whereas obviously Patient Track is good at that. So this way our staff are able to input the information in here, but you can also still view it on Patient Track. So it depends what view you like the most. So I'm going to scroll back up to our baby overview. So we've got our overview of baby, we've had our summary of care, all of our information of what we've taken and done here. If this baby is on transitional care, i.e. is something that would previously have been entered into neonatal Badgernet, in that it scores a HRG code, this information will be on this section. So you've got your trans care on here. So this, if someone has completed a daily summary for that day, you will get a summary of everything that's going on. So obviously your weight, your current diagnosis, what observations have been done, and your procedures and any drugs that this baby's on. And you can click on the individual notes. Obviously this has only got a date for today, to view those different forms as well. So if we click on it, it will bring up that specific form already, and obviously more comments can be added. So we may need to update our risk factors. So obviously we have a risk assessment over in this corner here. We can either add it by clicking here, so adding our risk assessment onto here. So you can say what we are querying. So obviously we're saying this baby is high risk. So from here we can then view our management plan. If we didn't want to view the management plan, we can go into it separately, and we can add in, obviously now we've added the risk factors, it will come up with a pre-programmed list of things according to those risk factors. And obviously these are on here. So this is from our protocols. So we can then import that management plan onto here, and we can remove bits that we don't need and add any extra information that we do want to add. So from there we can save and close, and our management plan is viewable here now. It will also be on your baby overview along with your risk factors as well. To be able to access that, if they don't have the trans care postnatal ward care open, you can do it from this form on your overview. So you've got your risk factors, you'll be able to add it from here, or your management plan, or you can search risk risk assessment baby, which will open the same form, or you can open up management plan baby, which again opens up that same form, and you can adjust it from what you need to there. If you were to do a review on the baby, you can add either it via an examination, a clinical note, or a specialist review. So I'll show you all those options now. So if we go into enter new note and we do clinical note, and again we'll select baby, so we can say who the person is completing it, so obviously our username, or if it is ourselves, we can click current user and it updates it. Our type of user, in this case, if you're not happy putting paediatrician, you can put other, so you could put ANNP. Your type of clinical note, so obviously it's either clinical or you might do it in relation to transitional care, so we would put test or whatever is appropriate. There's also the ability to add an illustration of the baby, so if you've noticed a large patch of bruising maybe on the top of the baby's head, you can mark that on there, or maybe a cut that you're querying as well, you can add that information onto this diagram. Obviously, once you're happy with everything, you press save and close, and then that is then viewable in your summary of care on your day. So we've got a clinical note baby here, which is the one we've just completed, and it says obviously there's an image available. If we want to see those notes in order, if we go into full notes for baby, and we can select specifically our clinical notes that have been written. So obviously here I've got all of the list of notes that have been completed. If I click clinical note, obviously we now have a view of everything that has been entered by the different users as well. Obviously, again, you can do that for anything else. So if you want to specifically bring up your microbiology tests, you can do that way, rather than having to look through every day and look through all of the notes. It can sometimes make things a little bit quicker. So I'm going to go back to my summary of care, and actually I'm going to enter a new note in the top here. So I'm going to do a specialist review for baby. Obviously, we know that we've selected the right form because it will have baby in brackets. And again, we can say who conducted it. Anything that appears in red is mandatory. Like that just said it was mandatory, so I had to fill that in. Obviously, we've got a type of user, we've got our ANMPs, neonatologists, our location. So obviously, most of the cases it will be postnatal ward. Our reason for attending, so you've got a medical review, baby on observations, those sorts of things that you would routinely observe the baby for, or you can obviously add other as well. You can say that you've noted your history, and then you can go through with more of a specific review, so your examination, your discussion, and your review. From here, you then also have links to your risk assessment forms and your management plan. You can also, when you insert a cannula, you can add that from here, and you can also go to your examination and observations forms. So it kind of groups them all together. If you're doing it on an iPad, sometimes these extra forms are on another page. So obviously at the moment we're in specialist baby review. On the iPad right at the bottom it will say edit or information. If you click on information, that will often have links to lots of different forms as well. So we can either do save and close. So I'm going to put, again, just for the purposes of this, test in each box. So I save and close. So now when I look at the baby's overview, there is a record of the latest specialist review. So we can click on there and it reopens the form so you can see what has previously been recorded. If you want to do more of an examination, so more of a top to toe, if we search for examination, again, select baby, we've then got more of a detailed form here. So it would be helpful if once the NIPE has been completed, that the information recorded on that NIPE is also recorded on here. But I do understand that potentially you may not have the time to do that. So if you can ask a member of staff to upload it into our documents, that will also be very helpful. So again, we say who examined the baby, we've gained consent, our location, have we checked that it's the right baby, and it's already told you what your gestational age is assessment. So it's brought over your family history from our booking that has been created. So obviously it's saying that everything is no, and your antenatal details you can add in here. This person was created as purely a postnatal patient, therefore these boxes aren't filled in. But if it was someone that had been cared for all the way through during their pregnancy, this would also be recorded for you. So you can obviously fill in as many boxes as you need to, or fill in all of it. So as we go down to the actual examination itself, you can do a button that says mark all as normal, like you can on the NIPE, and then you can adjust to abnormal as is appropriate. Or if you're not happy doing that, you can go through and do every one as you need to. As you scroll down, so it's a big long list. You've obviously got your reflexes, comments about the cord, urine and meconium, any comments about bowel movements, again, any more sort of information that you would potentially recommend for the baby, and then specifically say, do you suspect any abnormalities? In this case, we'll say none. You've then got that baby illustration again that you can draw anything, and note whether there's any referrals required. So obviously say it's a BCG. Baby fit for discharge, I'll say no at this time, and we'll say a BCG is required. And again, you can add in any extra notes at the bottom. So we do save and close. So again, this would now be viewable in our summary of care on our date today. So we've got obviously our specialist review, and our examination hasn't appeared just yet, but sometimes, oh, and there we go, talk of the devil, and they do appear. Again, if we wanted to search specifically, if we go into full notes, and we now have 2 baby examinations to look over, so we can see the differences there. So obviously I've said that it's a detailed examination, i.e. a NIPE, and that's done. So also our feeding information. So obviously on our overview, we have a link to a feeding plan here. So if you click anywhere on the text, it will reopen that feeding plan. Or if you don't do that, you can also do feeding and bring up your feeding plan this way. It will open up onto what's previously been recorded as a plan, and you can then adjust it as required. So feed 3 hourly is 30 mil, as an example. Then we do save and close. That's updated there. And I believe it's also updated on our pregnancy summary as well. As we scroll down, we've then got our feeding plan on the front there, so everyone is able to access it. So you may also need to access the social information. So you have on the side here a social tab, which will take us into all the information regarding social services and safeguarding midwives. So if any discharge plans are recorded in here, that information is there. Any drug or substance abuse is also in here. You have any links to correspondence, so any scan documents, any notes re mum, or specifically any notes re baby. So if you wanted to record a note yourself, say you noticed a bruise, an abnormal bruise on a baby, we would search for clinical note, baby. We would say we completed it, type of user. Again, I'll say Neo. Clinical note. If we record it as social, it records it in the place that we need to. Test Neo. Again, you've got room for another illustration, and we'll do save and close. So once we've saved and closed, this should appear in a second. It will also appear in your summary of care on your day, and it will be viewable at the bottom there. So this is the note I just inputted, and it should now have come across into our social and baby notes. So not quite yet, but again, it can take a minute or so to update. If the baby has any social input as well, there would be a yellow flag at the top, and it's the same on an iPad as well. On here, if there is a yellow flag, if you click on the yellow flag, it will take you directly to social information. I believe that is everything you need from the postnatal side of things. If you have any more comments or queries, please email myself or my colleague Steph Moss. I'll put our emails at the end of this video. I hope this makes sense and you've learned from it. Please, like I said, contact us if you need any more support.